Alice, this is a big deal.
It really is. It's going to be going on from the 13th to the 18th of July, and it's going to be the longest strike yet by the junior doctors. We had strike action last week, and to have this continuing again and again with no sign of resolution is, of course, of great concern to many people. And the timing of this is key because it's going to overlap with strike action by the BMA in Scotland as well. So there'll be that factor there as well. And crucially, junior doctors make up around 40% of our medical workforce, and so for them to go on strike like we've seen previously will have enormous impact on patient care. Of course, emergency care, as we've seen previously, will be prioritised, but for people who are perhaps having an outpatient appointment, something that's classified as non-emergency, that will undoubtedly be affected in hospitals across the country. And really, we continue to have this stalemate really between Stephen Barclay and the junior doctors continuing to demand a 35% pay rise, which Stephen Barclay has said is simply unaffordable. He's put forward a 5% pay rise, but they say that's not credible. And they're very much, the BMA have used examples really of the record number of junior doctors leaving to say that it's vital that they have a more significant pay rise in order to recruit and retain doctors. And the BMA have said today that many junior doctors, around half surveyed, are being inundated with adverts from other countries encouraging them to move abroad and work as doctors there, particularly in countries like Australia. And in fact, the South Australian government apparently paid for trucks with advertising slogans to be driven past picket lines over the last few months. And I think the worry there is that other countries that pay their doctors more are potentially using this situation at the moment, using this crisis really that we're seeing in terms of this ongoing problems with the junior doctors, using it to their advantage in trying to recruit junior doctors. But of course, Stephen Barclay says that this 35% pay rise is absolutely unaffordable. So the two sides are not meeting at any point in the middle. And like we've seen with the previous industrial action, it's very much patients who get caught in the middle of it.